This is The Business of Healthcare with Habanero, and my guest this afternoon is Vanessa Best. She is the 2017 United States Small Business Administration Women in Business Champion, which is such an exciting award to receive. She's an award-winning healthcare and business consultant. She teaches at the Small Business Development Center in Farmingdale and New York City at 26 Federal Plaza. She's also the co-founder and CEO of Precision Healthcare Consultants, a Long Island firm that since 1996 has been helping doctors and healthcare facilities get paid faster. So, Vanessa, thank you so much for joining me here this afternoon.
Oh, it is great being here, Sue. Thanks for having me.
You're so welcome. And, I formed my business in 96 too. So.
I know. We're joined.
We are, right?
In solidarity.
So why don't you take a couple of minutes and tell us a little bit about your background.
Sure. So my career in healthcare started over 20 years ago. I, like many folks, Sue, I worked in one of the largest hospitals in New York City. And I was at a point in my life where I was starting to have a family, have my first child. And I didn't want the hustle and bustle of working for someone. I really wanted to become an entrepreneur. And interestingly enough, no offense to any men that are listening, but there was a gentleman in my department who had started doing billing on the side for doctors. And honestly, I kind of looked at him and I said, he's not that smart. No disrespect, but I said to myself, Sue, I said, you know what? If he could do it, I could do it. So there was a doctor leaving New York Hospital Presbyterian. She was the head of occupational health. And I went to her and I said, you're a woman, I'm a woman. You're starting a business, I'm starting a business. You need patients to trust you. I need a doctor to trust me. She looked at me, she smiled, she says, I'm going to give you a chance. That was over 18 years ago. And the only reason why I stopped working with her is because she did so fabulous that the hospital hired her back. It was amazing. And that's happening here in Long Island. Doctors are going back to the hospitals.
Yes, and that's a good thing and that's a bad thing for us, right?
Yes, good and bad. But for me, it was full circle because when it came to helping her negotiate her terms, I was there at her side to do it. So from that, Sue, it just springboarded. When you do a good job for anyone in any industry, you're going to get referrals. And my referrals took me through New York City, through Long Island, through the country. And then we just started adding more and more services, more consulting services. But I think the thing that has really propelled my business, Sue, is something that you mentioned, and that is being certified in New York State as a minority and woman business enterprise.
So I think that a lot of people might not be familiar with that whole program and that concept.
Okay, so I'll kind of explain to you what that is. Here in New York State, there have been what's called disparity studies done. And what those disparity studies have showed is that although there is a large population of minorities and women within the state, unfortunately, women and minorities have not received traditionally their fair share of contracting dollars. So what I mean by that is if the state or the county has work that needs to be done and they put out a bid, in the past, women and minorities, they just were not well represented. So what's happened, there have been laws that are put in place that basically says if there is a contract over a certain value, if there is a business that is certified as a woman and a minority, and not just that brings them to the table, but that they're qualified to do the work, then that prime contractor has an obligation to really subcontract to a woman or minority firm.
It's what I find is interesting. What to me, the reason that a lot of that has come about is how do you get business traditionally? You do business with people that you've worked with before and that have a track record.
Right.
So what happened to women and minorities is they weren't even getting a seat at the table. Right. So they weren't having an opportunity to demonstrate their proficiency or or get the experience to be able to get the next job. So that's what I've found to be helpful with that. I used to be on the other side. The company that I worked for before I went out on my own had to hire, did a lot of government work, and always had to find and minority and women businesses to subcontract with, because a lot of the government work across the country requires it. And what we found was there weren't a lot of people to choose from. So you would wind up, this is again when I was with somebody else,
Right.
We'd wind up having to pay some senator's wife's law firm
Oh my God.
just writing checks.
Wow.
Because we couldn't find anybody that was able to do the niche kind of work that we were doing. So when I first started, that was my thing. I said, I am going to go out and be that WBE.
Yes. And that's wonderful. And so I know you've done some work here in the county with really helping women get that certification, which I think is amazing, right? Didn't you do some work here in the county?
Yeah, so I belong to an organization called the Suffolk County Women's Business Enterprise Coalition, which is SWEBEC for short, and it's a free county-sponsored organization. And what they do is all different kinds of things to help women participate and start businesses and connect with each other. And one of the things that they did was they run a program to help people get certified, just to have coaching and stuff to go through the motions. So I did that for about 4 years. That was board position.
Yeah,
with.
that's awesome. And I think, again, we have so many synergies. I am part of an organization on the city side. It's an initiative called We NYC, Women Entrepreneurs of New York City. And what we do there is, again, it's a free program through the city. It's funded through the city of New York. And we help women really learn about these amazing programs. Because like you said, Sue, if you don't have a seat at the table, you can't win. So being certified, does it guarantee you a job? Absolutely not. But it gives you a ticket to the dance. And once you show your work, your past performance, even if it's not from the county, if it's in the private sector, then you become very marketable. I mean, for me, even being here is amazing, because I've got to tell you, SUNY is one of the New York State agencies that is phenomenal with their MWBE participate. Can I tell you about two?
Yes.
Okay.
That's what I perfect segue.
Okay, great. So first of all, I have to say it all starts from the top. So SUNY has something called their system-wide administration up in Albany. And the person who charges that, Pamela Swanigan, just a forerunner for advocating women in minority businesses, and then her assistant Alice Robeson. They have both been amazing. So let me tell you about some of the things that my firm is participating in. Right here at Stony Brook, we're part of a subcontractor for a company called Press Ganey. Now, Press Ganey is one of the largest companies in the country for doing patient satisfaction surveys. And for those on the call who aren't familiar with that, what happens is Medicare and Medicaid, of course, fund many hospitals through the patients that come there. So they've come up with a program where they actually allow the patients to rate the hospital. So the patient will say, well, how do you feel you were, the survey will say, how do you feel you were treated? Was it a clean environment? Do you feel comfortable with the physician? Do you feel comfortable with the nurses? And based on the responses to that, the hospitals can either get money, or on the downside, they can lose money. So Press Ganey is an organization that helps not just navigate those surveys, but then if there's areas of deficiency or areas that are doing well, they manage that. And I'm so proud to say that they've taken us on as a subcontractor. Another contract that we have is with another Long Island company called Total Healthcare right in Belmore. And what they do is so interesting. We help them staff standard patients. So have you ever heard of a standard patient?
No.
I'm going to tell you, it's amazing. Medical students need standard patients, or kind of, I call them fake patients, that are really actors that come in and then they really they really measure how did they feel as a standard patient? How were they treated? Did they feel discriminated against? It's just amazing. So we're working with them.
So now, is this like maybe the very first step that a physician or a student would go through, where they know it's a setup, or are you sending someone to them like mystery shopping to see how they do?
I love it. Sometimes it's mystery shopping. So some of our standard patients, they may get dressed up as if they were victims of abuse, right? All different scenarios.
Yeah.
So they're professional actors that come in. They study the script. They study questions they should ask. They study their body movement, everything. And it really prepares the students here at Stony Brook to be fabulous medical clinicians.
That's so
Isn't it amazing?
That is really interesting.
Oh, my God. Yeah.
So now you've been certified as an MWBE
Yes.
in New York State for some time.
Yes.
And, anyone who's interested in doing it, the process is... It's really cumbersome.
Daunting.
You generate the equivalent of a ream of paper.
Yes.
And now, as a matter of fact, I'm in the middle of doing my recertification, and which really, I mean, as you know, it means you have to really do the whole thing all over again.
Yes.
But you could do it all online now, which is nice. So instead of having all that paper, you can just scan it all up.
Right.
So it's nice.
Yes.
But it's nice to get in that.
Yes.
So now, if people wanted to get in touch with you, I wanted to make sure we give out your contact information.
Sure.
So my guest today is Vanessa Best. She is the CEO and founder of Precision Healthcare Consultants, and you can reach her at 516-771-7554. And you can also, she's got an email address, and you can find that on my playlist as well. It's vbest@precisionhcc.com. And so I wanted to, what other suggestions do you have for people who are interested in getting into the business of healthcare?
Well, what I would suggest, Sue, is be flexible. Don't be narrow in your endeavors. So for example, we started out doing medical billing. We added coding. Now we're doing satisfaction surveys with a national company. We're now doing staffing for those same hospitals with a local company. Another thing that we should be open to is being a sub of a sub, right? So it sounds bad, but can I share one more experience?
Absolutely.
Okay.
I'm taking notes carefully because
Yes.
I'm in the same arena. So.
I know. So here's the other one. SUNY has 64 campuses. So they have a SUNY-wide contract with GEO Blue. Now, GEO Blue handles all of the international students. So when students come inbound to learn here, or students that are here that go and study abroad, the insurance that they have contracted with is GEO Blue. So I am a sub of a sub, SHA, Sullivan Hernandez Agency. They are the subcontractor on that. And what I've been doing with them is visiting SUNY campuses around the state, almost as far as Canada, training students, faculty, and parents about insurance. So it's all full circle. So again, what I would suggest, be very open in your approach to healthcare. Don't focus in. Look at the auxiliary things or ancillary things. For us, we do billing and coding, but we've partnered with someone who does transcription. We've partnered with an insurance company. We partner with staffing agencies, and also take advantage of all of the free services for developing your business, like the Small Business Development Center. The SBA has an amazing emerging leaders program, which I teach. The WeBank, which you're part of.
Okay, wait, I'm just going to interrupt you for 1 second because
Sure.
you and I are familiar with a lot of these acronyms,
Yes.
but other people might not be.
Oh, yes, yes.
So the Small Business Administration is kind of charged with helping small businesses all across the country. And they have partnered, or they've got locations at a lot of the, what is it, the community colleges?
Community and the four-year colleges. Like here in Long Island, they've affiliated with Farmingdale.
And there's one here at Stony Brook.
Yes.
And those are called Small Business Development Centers. And they have got some of the most amazing staff.
Yes.
And I've used them over the years for different things. If you've got a small business, and by the way, you don't have to be a woman or a minority to take advantage of these services. It's for small businesses. So let's just say, you're starting out your business and all of a sudden you realize, I need to figure out how to do some of this accounting stuff, but I'm not really in a position yet where I can spend a ton of money on an accountant. SBDC has courses that they can, and individual counselors that you can sit with, and they can help you step through what are some of the things that you might need to do to set up, or how do you work different things. Right. You can get help with research. It's so amazing.
Yes. It is. And there's even another one, Sue, that I'm thinking about. And I was ready to throw out an acronym, but it's called the Procurement Technical Assistant Center.
Yeah, PTAC.
Yes.
Yep.
Now, they're wonderful as well, because once you receive your certification, you want to sit with them for free, because they will help you identify subcontracting opportunities. They have been fabulous for me as well. So that would be another good resource to kind of put in your toolbox.
So, and if people had questions about how to maybe dig into some of this stuff, you'd be willing to take emails on that, right?
Absolutely. We help folks all the time.
Yeah. So if this has sparked any questions in your mind and you'd like some help answering it, feel free to get in touch with Vanessa, vbest@precisionhcc.com. And I'm just, I didn't even have to step through anything here. We just went through it all.
Yes.
Is there anything else that you wanted to touch on?
I think, again, collaboration is an amazing thing. Sue, I think we met each other. Somehow we were introduced. Then we met each other at a coding conference.
You were presenting. That was one of the times that I met you. But I had heard about you. Oh no, wait! I know what happened. I know exactly what happened. So I belong to a group called Healthcare Introductions.
Yes,
and it's a group of 60-something people who work primarily with medical professionals and or in the healthcare industry. And what we do is we've got an email group. So when you're looking for somebody to collaborate with, or when your client is looking for some kind of a service, a lot of times we ask each other and we refer each other out. And I don't remember exactly what it was, but one of my clients was looking for something. I sent an email to the list, and one of the attorneys sent back and said,
yes,
you have to call Vanessa Best. She does this for us all the time, and she's awesome. So.
Yes. So I would say being a part of those groups, and I would also say don't be afraid to form an alliance with someone who does the same thing that you do. So like Sue and I do some similar things, but we're in solidarity. And many times there are projects where you need more than one person. Sometimes there may be a procurement through the state or through the federal government where you need a woman and a minority. Never shut the door. Always have those good, strong relationships, because you just never know how either a person can help you, or more importantly, how you can be of an assistance to someone else.
I agree with that so much. I come across, and I think probably a lot of us do, a lot of people seem to become very proprietary.
Right.
And in fact, a lot of the networking groups have these rules. You can only have one person in a particular area of specialty. Mm-hmm. And to me, particularly with the kind of work that we do, there are all kinds of attorneys that handle different areas of specialty in healthcare. There are all kinds of billing companies that handle different specialties, different size clients, specialize in different kinds of systems that they use. So even the work that I do, consulting work, there are people that specialize in different areas of that, whether it's coding or auditing or operational work. So I find it silly to try to limit things because I don't know. I just find there's so much more you get out of doing that sharing.
That's right. We're in agreement. So that would be my biggest suggestion, especially for those looking to get into the business of healthcare.
Well, I want to thank you so much, Vanessa, for joining me today on the air here at WUSB Stony Brook.
Well, thank you, Sue. It has been my pleasure.